Thank you, Professor Carraro, for the invitation. I would like also to thank Professor Messina for the support in this study. We did it together.
But reason of time.
So just a few words about plantar fasciitis. We know it's the most common cause of chronic heel pain in adults, affecting both young and active patients, but also older and sedentary individuals. It results from repetitive stress to the plantar fascia, and its origin on the medial tubercle of the calcaneus, and it's often associated with the gastrocnemius tightness. But we know that the diagnosis can be made clinically with a focused history and physical examination. Imaging is reserved to atypical presentation and those that not respond to initial treatment. The most common presenting symptom is aching plantar heel pain, which is worse with first step in the morning, so they say, usually our patients, or after periods of rest. Diagnosis is confirmed with point tenderness at the region of the plantar fascia on the medial tubercle of the calcaneus. So we know that plantar fasciitis occurs in about 10% of the world population, with 83% of those patients being active working adults between 25 and 65 years old. The peak incidence is among 40 to 60 years, as said from Buchanan. So in general, the treatment is based on the level of pain referred by our patients. Rest, the use of ice after offending activity, the use of oral or topical NSAIDs, but also use of foot orthotics may offer benefits. Other more invasive techniques may be considered if the patient is unresponsive, while surgery should be considered the last option. Plantar fasciitis is not easy to treat, and patients' dissatisfaction is common with most treatments. So in this context, we explored a new frontier, a new kind of approach to this treatment in the plantar fasciitis, the use of an hypoallergenic, biodynamic, rechargeable kinesiology taping refilled with Ozoile. Let's see some characteristics about this taping. It has a 96% cotton with the added natural colloidal substances with elastic reticular structure, wave-shaped adhesive with the biostimulating function, which guarantees a high level of adhesion to the skin. And let me show you some characteristics about Ozoile. So, sable ozonides are a pool of molecules obtained through a patented process by reaction of a defined oxygen-ozone mixture with the olefinic bonds of organic olive oil fatty acids. Ozoile exerts its therapeutic efficacy mainly through modulation of the main biochemical pathways linked to inflammation and pain perception. At the molecular level, its structure enables the selective inhibition of the key enzymes in the inflammatory cascade. In particular, we know cyclooxygenase and lipooxygenase. So this targeted inhibition significantly reduces the production of pro-inflammatory mediators like prostaglandins, leukotrienes, thereby exerting a pronounced anti-inflammatory effect. And additionally, stable ozonide, so this pool of molecules component of Ozoile, have shown to possess healing biological activities. These include anti-inflammatory actions and pain relief, achieved partly by lowering the levels of pro-inflammatory cytokines, such as TNF-alpha, interleukin-1 beta, and interferon gamma, and by impeding the activation of nuclear factor Kb. So this oily formulation enhances its transdermal absorption, facilitating effective action in the muscular and joint tissue. We also had a rapid onset of action. Post-topical application provides immediate pain relief, crucial for fasciitis plantar pain. Additionally, the sustained duration of its effect ensured by taping has ongoing effects during this therapy. So these are some pics from our patients and how we put the kinesiology taping. So let's talk a little bit about the study. We enrolled a total of 30 subjects. We randomized it in 2 groups, one experimental group and one control group. These were the inclusion criteria. In what concerns the intervention, in a first general meeting, we filled out an NRS scale assessment for the perceived pain by both groups. Let me show you the path each group followed during this study. In what concerns the experimental group, about the therapy, I mean, therapeutic rest, kinesiology taping with Ozoile, application every 3 days for 15 days, and ice for 20 minutes a day, twice a day. Then, after these 15 days, a new pain assessment on an NRS scale, another time the therapy, and a final pain assessment on the NRS scale. What about the control group? Just therapeutic rest, ice for 20 minutes a day, twice a day, for 15 days, a new pain assessment on that scale, and again the therapy, and the final pain assessment. So what about the results? From day 0 to day 15, we had these results. We were not truly satisfied in this moment, but from day 15 to 30, we had a 40% pain reduction on the control group, but almost a 70% pain reduction on the experimental group. So the 3 claims of treatment I would like you to bring as a take-home message are, first of all, the anti-inflammatory and analgesic component of stable ozonides, the biomechanical component of kinesiology taping, of course, and the pharmacological component of natural origin known for thousands of years. Who doesn't know the extra virgin olive oil, treated with ozone that determines the formation of stable ozonides. And this is a food after 15 days of taping use. So there are no skin reaction. We registered no skin reaction. So on the understanding that the prevention of plantar fasciitis should be promoted more widely among the population, as should health education in this context, the study results indicate that the Ozoile-based formulation is significantly effective in reducing pain and improving functionally in fasciitis pain, especially when placed within an holistic, global and multidisciplinary treatment. The decision not to use corticosteroid for injection, which temporarily, it's true, relieve pain, but may increase the risk of plantar fascia rupture and fat pad atrophy, was widely appreciated by patients. It was also highly appreciated that Ozoile, with which the taping was refilled, was of natural origin. In this regard, we recorded no allergic or intolerance reaction to Ozoile during this study. The taping was well tolerated and changed by our team every 3 days after a careful analysis of the skin. It was a big work. This suggests that Ozoile, with its anti-inflammatory and analgesic properties, can be a viable alternative to conventional treatment for pain in this context. And despite promising results, this study had some limitations. The sample size was relatively small and the follow-up period was short. Having seen the results and assessed the final satisfaction from the experimental group, we decided that this study should be further developed to overcome the limitation that characterize it so far, in order to better understand the long-term aspects of the use of these methods and its application in the treatment of pain. I had some questions during the study. How important was the biomechanical effect of the kinesiology taping versus the biological action of Ozoile? Is it a combo effect, or is one predominant over the other? What is the effect over longer periods of use? Given the absence of skin reaction in this study, did the neutral color of the kinesiology taping matter? Did the involvement of blood microcirculation stimulated by the taping play a decisive role? But most of all, if the answer is yes, what other implications and uses might this taping have? So we assume that we have few conclusions here about this study, other than the data we recorded on this short period of approach to this new frontier, this new method, therapy method, but many questions and curiosities about this new frontier. The study offers new perspectives for the treatment of pain on a large part of the population, and not only on the treatment or plantar fasciitis, suggesting that combinations of pharmacological and kinesiology taping therapies may be more effective than conventional methods. So this could lead to better pain management and an improvement in the quality of life of patients, positively impacting their life quality and sport performance. And that's all, folks. Thank you.